I'm a psychology student, and this is my paper on why I don't think adolescents should medically transition. Enjoy!
Adolescents should not medically transition. August 1st, 2024. Introduction. A pediatric endocrinologist, Norman Spack, told New York Times that transgender children need puberty blockers in the early 2000s. This sparked a sudden trend for gender dysphoria, and transgender teens has turned into a hysteria that needs to be fixed. Marciano, 2021. The sudden outbreak has mainly affected adolescent girls. 15 years ago, this was never the case. Doctors are treating gender dysphoria like a medical issue rather than a psychological issue. Marciano, 2019. We need to readdress how we are treating teens with gender dysphoria. In the last few years, there has also been a rise of young adults detransitioning. Most of the stories emerging are anecdotal. Most teens are heavily influenced by peers and social media. Treating teens with gender dysphoria as a medical issue can be irreversible, especially for girls. Entwistle, 2021. Gender dysphoria should not be treated with puberty blockers in adolescents or minors. Gender dysphoria does not always result in being transgender. We need to figure out why a teen thinks they are trans rather than just prescribing puberty blockers. What is gender dysphoria? According to the DSM-5, gender dysphoria, GD, is a marked incongruence between their experienced or expressed gender and the one they were assigned at birth. GD was previously known as Gender Identity Disorder, 5th edition, DSM-5, American Psychiatric Association, 2013. However, it does not say that all those that are suffering from gender dysphoria are automatically transgender. In rare cases, when someone suffers from gender dysphoria, changing their gender medically or socially can help with the dysphoria. Because of the rise in celebrity doctors and social media, the sudden rise of teens claiming to be trans and have GD has become a hysteria. Marciano, 2021. In an interview hosted by Buck Angel on his channel, he interviews two therapists about teens and gender dysphoria. He interviewed Paul Garcia-Ryan, a psychotherapist in private practice and the board president of Therapy First. In the interview, Paul comments that gender dysphoria is a unique disorder that can affect non-binary and gay teens as well. Not just trans teens suffer from gender incongruence. Medical intervention should be a last resort as an adult. Paul Garcia-Ryan, 2024, 26:30. Why is this happening? According to the article Transgender Children, The Making of a Modern Hysteria, by Lisa Marciano, 2021, the sudden trend of the rise of gender dysphoria appeared to start in the early 2000s. A pediatric endocrinologist, Norman Spack, told New York Times that transgender children need puberty blockers. He opened his own clinic in 2007 and eventually gave a TED Talk that reached over 1 million views on YouTube. Marciano compares the increase in the number of children and teens self-identifying as transgender to the surge in cases of young women showing symptoms of hysteria at the end of the 19th century. Marciano, 2021, adolescents are claiming to be trans without any history of having gender dysphoria, mostly girls. Marciano mentions in another article, Response to Comment on Outbreak, on Transgender Teens and Psychic Epidemics, that 15 years ago it was completely uncommon for young adolescent girls to have gender dysphoria and want to be transgender. It's not uncommon for an adolescent to feel uncomfortable in their body. Girls are even more vulnerable than boys are. In our textbook it shows that most adolescents have some sort of identity crisis. Role experimentation during adolescence frequently expresses various appearances, images, and behaviors. Theorists like Erik Erikson suggest that the opportunity to explore different roles is crucial for developing a coherent sense of identity. Steinberg, N.D. So yes, it is normal for teens to be confused about who they are, but that is part of being a teen. So, the reasons for sudden gender dysphoria are a combination of social media, peer pressure, and miseducated doctors. Instead of therapy, doctors are providing puberty blockers to any teen claiming to be trans without putting much investigating into it. Marciano, 2019. What are the consequences of medically transitioning as a minor? The problem is we don't know enough yet to understand all the long-term consequences of transitioning as a minor, and that's why we should not be taking a risk with children and teens. Transitioning as a minor can have irreversible side effects later in life. There now has been a rise of young adults in their early 20s detransitioning. Most who transition as a minor were not properly educated about the risks of transitioning, nor did they have much follow-up. More stories are emerging on social media platforms about detransitioners sharing their stories. Entwistle, 2021. One detransitioner that is well known now and that caught my attention is Chloe Cole. Chloe testified before a House subcommittee July 27, 2023, explaining how transitioning as at just 13 ruined her childhood and will have a negative lifelong effect. Chloe quoted the doctor that told her parents, "Would you rather have a dead daughter or a transgender son?" Chloe Cole, 2023, The Daily Signal. So instead of looking into why Chloe felt the way she did, the doctor used fear to convince Chloe's parents to give her puberty blockers. Chloe's doctor should have had her mentally evaluated, and therapy should have been the first line of defense. Puberty is a natural process that every human should be able to go through. To rob a child of that should not be legal. Some are being left sterile and lack any type of sex drive. This approach is hurting adolescents more rather than helping them. Butler and Hutchinson, 2020, highlight the importance of acknowledging young people who desist and detransition, wanting a shift in clinical practice to better address their needs and integrate their experiences into theories of gender dysphoria. Entwistle, 2021. This tells us that more and more doctors are realizing the risk that adolescents are being subjected to. There need be a different approach to how we are treating GD in adolescents. In a short interview on the YouTube channel, The Daily Signal, Dr. Michael Laidlaw, an endocrinologist, states that the research that has been done is just from a very small group of people. He also says that there is a lack of controlled studies or intense research done when involving puberty blockers for kids and adolescents. There is heavy-duty propaganda. Dr. Laidlaw, 2019, 1:15 minute. What are alternatives for trans teens? Transitioning is a personal process, and there's no one right way to do it. It's important for transgender teens to find what feels right for them and to have a support system in place. There are ways for teens to transition without doing irreversible damage to their body. The most common is to socially transition. Social transitioning involves changing aspects of one's social life to match with their gender identity. Examples are altering clothing, hairstyle, and accessories to better match the desired gender identity. This can include things like binding, tucking, or padding, as well as makeup choices. Someone can also change their behavior and mannerisms by adopting different body language, gestures, and mannerisms. Some teens may choose to pursue legal changes to affirm their gender identity, like changing their name. These are all ways to help teens express their gender identity. None of this is permanent or life-threatening. If a teen still feels the need to transition medically, then once they become an adult, they can have the freedom to do so. What should be done now? Gender dysphoria is a mental issue, and if an adolescents feel like they are struggling with GD, then working with a mental health professional who specializes in gender issues can help teens explore their feelings and develop coping strategies. Maybe it's something other than GD. This is why it's important to find access to educational materials and resources about gender dysphoria to better understand their feelings and options of treatment. In some cases, I believe that adolescents can suffer from gender dysphoria. However, some teens may find relief in social transitioning, such as changing their name, pronouns, or clothing without medical interventions. If gender dysphoria persists after puberty and adolescence, then once in adulthood the medical options could be discussed. During adolescence, the sense of well-being that comes with forming an identity is often temporary. Teens frequently make commitments and plans, explore various identities, rethink them, change their commitments, and continue exploring. Steinberg, ND. It's important for teens and their families to work closely with a mental health care provider to consider the best approach for any type of unique situation. Adolescents who are expressing gender dysphoria should consider a range of supportive and therapeutic options before deciding on medical interventions like puberty blockers. Conclusion. Because of the rise in celebrity doctors and social media, the sudden rise of adolescents claiming to be trans and have GD has become a toxic trend. Gender dysphoria is a unique disorder that can affect non-binary and gay teens as well. During adolescence, the sense of well-being that comes with forming an identity is often temporary. Puberty blockers should not be the first line of defense. Because of the lack of research done, there has been a rise of young adults detransitioning. I personally feel like we might be ruining a whole generation of adolescences. Gender dysphoria is a mental issue, and if an adolescent feels like they are struggling with GD, then work with a mental health professional who specializes in gender issues. When transitioning, there's no one right way to do it. It's important for transgender teens to find what feels right for them and to have a support system in place. Sources: 1. American Psychiatric Association. 2013. Diagnostic and Statistical Manual of Mental Disorders, 5th edition. 2. Entwistle, K. 2021. Debate, Reality Check, Detransitioners' Testimonies Require Us to Rethink Gender Dysphoria. Child and Adolescent Mental Health, 26, 1, 15-16. 3. Marciano, L. 2019. Response to comment on outbreak, on transgender teens and psychic epidemics. Psychological Perspectives, 62, 2/3, 290-293. 4. Marciano, L. 2021. Transgender Children, The Making of a Modern Hysteria. Psychological Perspectives, 64, 346-359. 5. Steinberg, L. ND. Adolescents 13th edition. Retrieved from 6. https://www.youtube.com/watch?v=DSGGR3W_JJG. 7. 8.